Up next on Zoom, we have Dr. Joy Obayemi.
Hi, good afternoon. I hope you all can hear me okay. Good afternoon to the committee and to everyone in the room. I apologize for not being able to be there in person. But yes, my name is Dr. Joy Obayemi, and I'm a physician and a general surgery resident at the University of Michigan Hospital System. And I really appreciate the opportunity to testify on behalf of SB 599 and to share a bit about my perspective as a physician on this issue. In my work, I care for a wide variety of patients. I counsel patients in the clinic who are considering elective surgery. I see patients in the emergency room who need emergent surgeries, and I care for patients who are critically ill in the intensive care unit and approaching the end of their life. And I've also had the privilege of caring for many patients who are incarcerated, who seek care in our hospital system. And I firmly believe that every patient has the right to die with dignity, and that at the end of our lives, we are entitled to respect, compassion, and appropriate medical care, regardless if a patient is incarcerated or not. This is also an opinion that's shared by the AMA, the American Medical Association, which has previously stated that the continued incarceration of patients with serious or debilitating illness can constitute a violation of human dignity. So also to talk a bit about frailty. Frailty is a concept that we discuss in the medical setting quite a bit because it has a tremendous impact on patient health outcomes. One can define frailty as this aggregate loss of function across multiple organ systems. And as physicians, we determine frailty by taking a comprehensive patient history and by performing a comprehensive physical exam. And patients who are frail often have great difficulty completing their activities of daily living and are at great risk for injury. Having cared for many frail patients in the hospital, I have a sense of how precarious these patients can be and how often they require additional medical support. And I think it'd be incredibly challenging for frail individuals to receive the care that they need in the prison setting. They really are better suited for care in a home with medical support or in a care facility. And I think the proposed bill would allow for frail patients to really take advantage of the compassionate release policy that was previously passed. And these are individuals who have a hard time walking or standing independently, individuals who have terminal diagnoses, as has been mentioned, and have months to live. And it's important to note that these patients are generally very debilitated and pose very little threat to others in that kind of a medical state. So as a physician, I think that, we have a society, we have a collective duty to provide appropriate and equitable medical care to all individuals, particularly those that are incarcerated, who are, in fact, some of the most vulnerable among us. And I feel that this bill would allow us to really do that. So thank you again for your time and for the opportunity to speak today. And I'm happy to take any questions.
Thank you very much. Any questions? Senator Johnson.
Thank you, Madam Chair. I was wondering if you could tell me what you think might be a couple mental health conditions that would result in a life expectancy less than a year.
I think that's challenging. I think when it comes to specific mental health diagnoses, as has been mentioned, things like Alzheimer's, dementia, of course, those can be categorized as, being a general health condition as well as a mental health condition. So I really can't speak to what the writers of that section specifically had in mind, a little bit beyond my scope. But I will say that there are certainly mental health conditions in which patients are thoroughly debilitated. And I think, Parkinson's, multiple sclerosis, all of the ones that have been mentioned that have a neurocognitive component of debilitation could certainly qualify as being a terminal diagnosis if at a certain point. But other than what's been mentioned previously, it'd be hard for me to really know what the writers had in mind with that statement.
I see. I thought you might have seen some cases. I'm just not clear because all of those are considered just general health in all the medical books. They're not part of a mental health list. So I'm just kind of curious, trying to figure out what it could be. But thank you so much. I appreciate it.
No problem.
Thank you so much for your testimony. Any other questions? Okay. Up next, we have Justin Counts.